In the wake of Covid-19, supporting older people to eat well, age well and live well has never been more needed. And of course, Covid-19 touches every part of our lives. And at the start of this year, when we were coming to the end of the research, we were hoping for a parliamentary event to be launching this. However, it's great that we can go ahead in the format that we're in to share this learning and launch the new research, which has never been more relevant. So I'm delighted today to be alongside Dr. Kate Reid and Professor Catherine Lido, who led on the research that we're jointly launching today, and we'll hear from them. I'll give a bit of an overview of the journey to this research, and then we'll also hear from Laura Cairns, who leads our Eat Well, Age Well project, to hear a bit more about the progress that we've been making over the last 3 years. But firstly though, I'm really delighted and pleased to welcome today Claire Adamson, MSP for Motherwell and Wishaw, who is with us today. And Claire's going to be able to say a little bit about Scottish Government and its plans and meeting commitments around tackling malnutrition among older Scots and the importance of this research. So welcome, Claire. Thank you very much for joining us today. We're delighted to see you, and I'm going to hand over to you.
Finding my off mute button there. Good afternoon, everyone, and thank you very much for the opportunity to speak this afternoon and for attending this event. Of course, it does mark the launch of the research conducted by Glasgow University Food Train and the lottery-funded malnutrition project Eat Well, Age Well, and my thank you to all of you who have taken part in the research project. And we're focused now on how older people are living and ageing in Scotland. And just to say that it is a real shame that we couldn't have an event in the Parliament to cover the research and have these as normal, but I'm really glad that we've got an opportunity to discuss it today. Many people have faced unprecedented levels of food insecurity, and the impact of the health crisis, COVID crisis on older people has been keenly felt across the world. The research findings link directly to the themes of food insecurity, loneliness, and health and social care. And while we must emphasise that these are not COVID-19 problems, the challenges faced by older people have been underlined and exacerbated by the outbreak, but we cannot view these through a single lens of the current crisis. The problems existed prior to the pandemic, and our societies recovered from COVID-19 must galvanise systemic and sustainable change. In essence, we must build a fairer Scotland for older people. We must ensure that the challenges faced by older people, food insecurity, loneliness, health and social care, are met with a practical rights-based governance. A rights-based response is needed, in my opinion. The government has committed to the care review, which will be key in designing services and health and social care in the future in a post-COVID world. COVID has affected each and every person, and there are few upsides to the new normal. However, I have to say I'm in awe of the local response in my own constituency to the pandemic. Various organisations in my area, such as Made for You and ML2 and Scran for the Clan, have stepped up to help our most vulnerable people. The community's response across the whole of Scotland has been nothing short of inspiring. However, societal issues, food insecurity, isolation and social care cannot and should not be solely met by the third sector. Food is a human right, and we must make every effort to ensure that this right is realised for everyone in Scotland. The Scottish Government has taken tremendous steps to tackle insecurity during the crisis with £70 million food fund, and it has more than doubled the Scottish welfare budget to support people. But looking beyond the COVID crisis, we must reframe these issues not as challenges to be met by charitable endeavour, but as a government imperative and a societal responsibility. If vulnerable people have to face food insecurity, then this is an issue of rights, and it necessitates a rights-based response. I and many of my colleagues have consistently called on the UK Government to overhaul our social security system. We need a compassionate system of social security founded upon principles of dignity and respect. There is work underway in Scotland looking at new ways of dealing with these challenges, such as a Citizens' Basic Income Feasibility Study Steering Group, which will provide a better understanding about how universal basic income could impact on poverty, unemployment, health and financial well-being. To meet the challenges of an ageing population, the Scottish Government strategy, A Fairer Scotland for Older People, a Framework for Action, outlines the priority actions to tackle the barriers to a positive older age identified by the Older People's Strategic Action Forum. It's impossible to cover all of the points raised in this framework, but malnutrition has been specifically identified as a key issue affecting older people, and it seems timely to highlight the issue now. The national commitment was made to tackle malnutrition in A Fairer Scotland for Older People. It's an oft overlooked aspect of public health messaging, so it's heartening that the Scottish Government have included it in the strategy. But there still remains a dearth of public awareness on this problem. Approximately 100,000 older people over the age of 65 in Scotland are at risk of suffering malnutrition. And this is what we must tackle going forward. I'm very conscious of time. I could have spoken for a bit longer about the strategy, but I hope that gives an outline of what the Scottish Government and what my colleagues in the Scottish Parliament are doing to take this matter forward. Thank you.
Claire, thank you so much for that a really robust overview there of what Scottish Government are doing and what the thinking is. And yeah, absolutely, great to see within the framework malnutrition being featured there. And yeah, I think also, your words around the social care review and the opportunity that presents for the reconsideration of food. Food within the care system hasn't been looked at since Lord Sutherland's review of 2007-2008. And very little action happened thereafter. So I think it all feels very, very timely, and obviously the right to food a very profound and very strong one. So thank you very much for that. I'm just going to move us on next, and I'm just going to give you a little bit about the journey to this research, because its roots are quite long and quite well established. And just take a few minutes just to give you a bit of an overview of how we've got to where we are today. And I'm going to do the fabulous screen sharing, and hopefully my presentation will pop up. Okay, so just if someone can give me a quick thumbs up that they can see all this okay. Great, that's super. Thank you for that. So the journey to this research didn't just start sort of a year ago when we actually were doing the research. It started quite a bit further back. But to go back even further, over 25 years ago, when Food Train was set up as an organisation by older people to help other older people with food access. And over those 25 years, we've been developing services to help older people eat well and age well, in a manner that's been about responding to what they've asked of us, based on those developed feelings of trust and confidence in the regularity of our support to them. And we're now bringing practical, social and emotional support to thousands of older people living at home in Scotland. The services that Food Train provide are built around the experience that older people share with us about the tipping points in their life, in their ageing journey, and the resulting impacts on their day-to-day living. We may support an older person for a week, for a month, a year, or even 10 or more years now, depending on their ageing journey and what they need from us. Governments and their policies come and go, and the world around us changes constantly, none more so than this year. But essentially over the last 25 years, what our older members have asked for us has remained unchanged. It's about food, about company, and feeling safe and cared for as the top priorities. The journey to this research has been a shared vision of understanding the food needs of older people living at home in Scotland, with a collaborative process that was designed and testing this research with older people directly. But what lies behind the data and the stats are the real lives and stories of older Scots. And over the last 6 months, older people in Scotland have been really adversely impacted by the pandemic. So I'll just give you a bit of a flavour of the impact that we have seen directly with older people and how important this makes this research. So Food Train has grown in an unprecedented manner, and unprecedented seems to be the word that we're all saying every day at the moment. But it really has been At one point, we were up to 129% of an increase in the activity of our shopping, our supported shopping service. So a huge number of older people being supported. Through our meal maker service, a huge number of home cooked meals being shared with older people, dropped off in the doorway, those friendly visits in the home having to be stopped in the meantime. In place of all that, though, the contact that we had with older people, we had to do something else to maintain that level of feeling cared for and reassurance that older people have needed. So that came in the way of phone calls, and in 6 months, we've made just around 10,000 phone calls to our older members for a blether. And in terms of what we've been able to achieve around the deliveries of fresh food and groceries in the areas that we cover in Scotland, that's up to close to 40,000 at this point in time, which is a significant number more than what we would normally have expected for this time of year. And we've been really lucky that we've been able to do that with thanks to the help of many more older volunteers, particularly while our older volunteers have been shielding. So why is all this never more needed? So this journey to this research goes right back to 2012, when the UK government were setting up a malnutrition task force with Westminster Department of Health funding, but that had no remit in Scotland. And that led a number of people working in this field at the time to start to think about what does that mean for us in Scotland and how can we tackle that. Foodtrain was lucky to be part of a study tour that went to London looking at a number of different food projects, and then the conversations continued thereafter. Foodtrain continued to lobby the Scottish Government to bring this agenda to the fore. And in partnership with Scottish Government, we co-hosted a malnutrition summit in May 2015. That brought together over 70 individuals, from older people themselves to third sector to public sector to academics, to talk about this issue. And everybody agreed it was the first time that we'd really all been in the room together, and that we needed to keep this conversation going. That report was published and created 13 recommendations that were agreed by those attending. Those recommendations were then discussed by cross-party groups, both the food and older people's groups, and there was calls for some actions on those recommendations. However, that's when things really began to stall, and there was a real sense that we had come this far, but there was nothing really happening. So Foodtrain, with the support of lots of other organisations who'd been involved in the conversations, decided that we could try and do something from the ground up. And we were really grateful that the National Lottery Community Fund came forward with 3.5 years of funding which has allowed us to set up our Eat Well, Age Well project. So the Eat Well, Age Well project, and the plan for that work was really very much about trying to focus on reaching every corner in Scotland to raise awareness of risk and prevalence of malnutrition among older people, particularly picking up on Claire's point that this is often something that's not very much discussed, or it's seen as something that's the domain of the NHS. But as we know from research that did appear in 2013, 93% of malnutrition exists in older people living at home. So by far the biggest proportion of that population affected lives in the place where the guidelines or the standards don't affect. So this was our job, was to try and tackle that through reaching every part of Scotland, through providing information, toolkits and resources in lots of different formats, providing training and support for volunteering, for informal and formal carers, and anybody really, families included, working with older people where there was food involved. We also thought it would be a great opportunity to give out some small grants. I know, remember in the early days of Foodtrain when we were very small, £500 was a lot, and we could do a lot with it, when you've got that, on the ground reach. So we were really delighted that Lottery allowed us to do that, and we've given out a number of grants, and Laura will talk a little bit more about that. But we really wanted to try and work on new ways of doing things within Foodtrain, but also with others in terms of health and social care staff, other third sector organisations and other parts of the public sector. And testing screening methods that could work in the community rather than formal clinical tools was also going to be a big part of this work. And really it was about trying to bridge the gap between clinical and community in terms of supporting older people to eat well. and also really continuing to be open to any idea that was out there on how we could work together to reduce the risk and prevalence of malnutrition among older people in Scotland. But for this research, we knew that we were starting from a pretty poor point, actually, that there was no Scotland baseline data on malnutrition in community living older people. The data exists at a UK level, and it's very much extrapolated data around must screening that's been translated. So about conversations with older people, we knew that was going to be important. We had limited access to information on the Malnutrition Universal Screening Tool data for Scotland specifically as well. In preparation for Eat Well, Age Well, we had held 85 conversations with Food Train members talking about their meals and their memories, and that had highlighted so many areas where food was the connecting part in their life to their memories and to how they were living now and to other people. So we knew it was going to be important that conversations with older people were going to form a big part of this research. And Food Train's experience to this point had been gradually watching the social care system cuts that had been leading to that increasing deficit in the provision of food access, community meals, meals at home, and the opportunity to eat with others. And a clear knowledge gap that was about understanding food insecurity for older Scots and being able to separate that out from the financial insecurity side, but being able to understand what might be the associated links between malnutrition and social factors. So that brought us to this research partnership, so that it was underpinned by a long period of work that brought us to the point of being able to pull something together with the help of Glasgow University. And I'm delighted that we've got to the point today that we're able to publish this research. So we knew that we wanted to look at older people at home, their nutrition, their food security, their well-being, and those loneliness measures. And I'll not say any more about that, and I will very much leave that to the researchers. So that's me for now, and that's a bit of an overview of how we got to where we are today. So without further ado, I'm going to hand over jointly to our colleagues from Glasgow University. So a very warm welcome today to Dr. Kate Reid, lecturer in psychology, and Professor Catherine Lido, senior lecturer in psychology and adult learning from Glasgow University. So over to you both, and thank you very much for being with us today.
Great. So I'll introduce myself first, and then Catherine. She's not only IT support in the background. So we're based in the School of Education. My name is Kate Reid, and I was the principal investigator for this piece of research with Food Train and Eat Well, Age Well. Catherine, do you want to say hi?
Hi, I'm Catherine, and I'll be talking primarily about the quantitative survey findings today.
Are you okay to move on?
Sure.
So as Catherine and as Laura and Michelle have indicated, this is a very collaborative piece of work. There was a lot of work that had already been done to this point. So when we came and discussed with Food Train, they already had quite a clear vision. And so, yeah, there's a great partnership that's already been put together here. And the research took place over 12 months, which is quite a short research cycle. So as a result, we were pretty ambitious, and we had a number of aims, but the two that are particularly relevant to today are we wanted to evidence the impact that the Food Train services was making on key outcomes related to both physical health and psychosocial health for older people utilising its services. And we looked at in comparison to those individuals that maybe were doing okay at home on their own, but maybe with friends and family stepping in as and when required. We wanted to use these findings to enact change, to make a difference, as we want to do as researchers. We don't want to just do research for the sake of it, we want to make a difference. So, and part of today is evidencing that. We want to cascade these research findings more widely to establish networks and to the Scottish Government to inform and strengthen existing and future policy going forward. Also to think about the expansion of services and the more secure expansion of services, not just in terms of emergency response that's been witnessed through COVID, but a long-term sustainable service to older people as they age at home. So positioning our research, some of this picks up directly from the great background that Claire gave there. I suppose it's important to recognise the complex socio-political landscape where governments can meet and if possible exceed the needs of our ageing population. Our partnership with Food Train and Eat Well, Age Well focuses on what's termed ageing in place. So how the older person can be supported to enjoy a full and a positive life in their own home or a homely setting. And our focus is on the provision of the social care and third sector support offered within the community, rather than support offered within residential or care home settings. So in particular, we were interested in evidencing the food access issues. So for instance, accessing the food system, shopping, deliveries, preparing, and also the psychological enjoyment of food, which older adults face within their community. We wanted to contextualise these. So in 2015, Scotland became one of the first countries in the world to adopt the UN Global Goals for Sustainable Development. And these goals provide a framework for countries to work towards eradicating poverty and to promote prosperity, including tackling climate change. And these goals are embedded throughout the Scottish Government's new National Performance Framework. And the work of Food Train and Eat Well, Age Well clearly aligns with the Sustainable Development Goals, which include zero hunger, good health and well-being, and sustainable cities and communities. And we've watched closely how the Scottish Government's Good Food Nation policy has set a new vision for Scotland, that by 2025, we will be a good food nation, where people from every walk of life take pride and pleasure and benefit from the food they produce, buy, cook, serve and eat. However, to echo the rights-based approach that Claire has given us, we know that access to regular nutritious supplies of food is not recognised in Scotland as a human right. And this has limited the impact of existing policy for vulnerable groups. So we're really pleased that Scottish ministers are now beginning to recognise that there is a clear place for legislation to underpin the significant work already being done. And we watch closely how a human right to food can be located at the centre of policy making and delivery, not only for the Scottish Government, but for the wider public sector. So that's a bit of background. It's quite meaty background, but I think it's important to foreground our research. So let's get on with our research. We approached it with a very ethical, inclusive, and I suppose a kind approach. We were given the benefit of having quite good access to older adult groups that maybe are quite difficult to access living at home, often alone. We used mixed method research, which simply means we used a measure of a number of measures that we'll come on to, mixed survey measures mixed with more interview to get some rich data to blend into that. We capacity built with our research. Our research was ambitious and done in quite a short time frame. So we used field workers who were often our own students and built their capacity as active researchers, which was super. We researched in context, and the next slide will give you some of those contexts. And if possible, we actually brought older people together to do some of the surveys in a supported environment, such as a lunch club or an afternoon tea. So we visited across 41 individual research sites. We met older people who are not clearly a homogenous group. Some of the older people were attending lunch clubs. We were able to visit people at home. We were able to do some postal survey work with people that were maybe too poorly to attend any of these lunch clubs. We saw people who were thriving, who were having a fabulous experience of older age, but we also saw people who were very alone at home and quite vulnerable, waiting on, services coming to them to help support them.
Can I just jump in and say that these are not stock footage images, that the Shugalele band there and the line dancing were from our data collection opportunities.
So, as I said, we did mixed method research. We approached it as psychologists, not just interested in the physical expression of aging, perhaps through height and weight. We were also interested in psychological, psychosocial factors as well. So this is what we call a biopsychosocial lens. We used measures which were really interesting, community-based measures. So one of them, which we can maybe talk about as part of this, was the Patient Association checklist, the nutritional checklist, which indicates very early indicators of undernutrition and malnutrition, such as rings becoming looser, unintentional weight loss. We use standard measures of food insecurity that you will see in the Scottish Health Survey. We used a standardised measure of well-being, loneliness, indicators of social support, a locus of control, which was an interesting measure where it gives an indication of how in control that older person feels about the decisions that are happening in their daily lives. So the research tells us that somebody who feels quite in control of enacting decisions that are good for them has a higher internal locus of control than somebody who may say, I just have to go with what's happening around me. I don't have any control of situations. Internal locus of control is associated with greater health and well-being than a reliance on exclusively external locus of control. And we also did a small sample of quite detailed qualitative interviews with older people that lasted around 45 minutes.
So this is where I jump in with some of the findings. Don't think you have to take all of this in at once. We will email you a PDF of this presentation so you can digest the findings more fully at a later time. So you can see that we had a predominantly female sample, which is not surprising, 77%, but we did have men participating with us as well, largely living alone, but we had all different types of accommodation situations. Many declared a disability, and 33% were food train members, with 63% having no structured food service support. So here's just a little bit. Also, we tried to get people across different deprivation quintiles in Scotland. And also, although we had 91% white participants, we did reach out to various, we had like the Wing Hong Center with older adults taking part there. So we did have a really nice cross section of Scotland. So for our first research question, we wanted to really look at the relationship between these more physiological measures of food insecurity and malnutrition risk with these more psychological variables of well-being and loneliness, but also the social support ones as well. And we just wanted to get an idea of how these factors change in our sample. I should have said, apologies for skipping ahead, that we've got the average age as well was 79.51. So the average age of our sample of a person taking part of the 169 surveys was nearly 80, and it ranged within a standard deviation range of 8 years. What we found was in these older adults that aging was associated with decreasing BMI. So that's something we might need to explore later. But in terms of physiological height and weight, we did find this association. And in addition, that older age was associated with more food insecurity. But equally, we had an interesting thing where our older participants were less likely to live in the higher areas of deprivation. And I'm not sure if that finding is just naturally coming out from who we sampled, but there do seem to be some changes as our population is aging. There was a relationship with lower well-being, but it was only marginally significant. So we don't want to make too many claims, but it does appear that there are some negative changes taking place in our sample as aging occurs. And within this, we didn't find particularly high levels of food insecurity with our measure, although Kate can talk a little bit more about why that might be. So we had 88.8% food secure, 95.6% one or below indicators. So mostly food secure, and only 4.4% with moderate to severe food insecurity. So, but the interesting findings for us emerged around the concept not of not being able to afford food, because it was a largely economic measure, but the indicators of early risk indicators of malnutrition risk, which emerged for 44.6% of our sample, which is higher. It's actually double some published work in the field. So I'll just show you a little bit what this looks like. If you look at the bottom of the table here, you'll see overall no answers to any of the patient association nutrition checklist. That means no risk at all, 55.4%. But for 44.6% of our population, they indicated yes to one or more of the 4 items, which include your family being concerned about your weight loss, you experiencing unintentional weight loss, loss of appetite or interest in eating, and your rings becoming looser. And those sample percentages are given at the top of the screen one by one. If you look at that little histogram there, you'll see that only 6 of our participants answered yes to all 4. But in order to trigger early indicators of risk, you only need 1. You only need to say yes to 1. So this is really interesting in that the sample, it was much higher than we expected for early indicators of malnutrition risk. And in addition, we're finding that if you look at the second half, that malnutrition risk is associated with lots of negative things like lower well-being, greater food insecurity, greater chance of loneliness, less social support, and more importantly, what Kate was talking about, which is this having a more external locus of control, that is feeling like you're not in control or empowered over your life. So now we're starting to create this relationship between the physiological indicators and the psychosocial risk. So again, we'll send you this presentation. At the bottom of each are the statistical values. These were done, for instance, with Spearman-Rowe, and you can go ahead and look at those values yourself if that's of interest to you. Our second research question, though, was, okay, that's establishing the relationship between physiological and psychosocial risk indicators. What about the nature of food services? Are there any differences between those in receipt of food train grocery deliveries and meal making and those who don't have any food support? So this is a hypothesis of difference, if you like statistics. So we did these with non-parametric equivalents of t-tests, if you're into that, the Mann-Whitney U. So what we found here was that actually there were some differences. Those who were in receipt of food train support overall had lower well-being, greater levels of loneliness, less social support, and were more at risk for food insecurity. Now, this is not surprising. It shows us that this is a more vulnerable group. And obviously that would be why they're engaging with food train services. They were also had a statistically lower average BMI. There was no differences in gender, living alone, or interestingly, area deprivation between those receiving food train support and not. But the interesting or maybe less expected finding was that the food train members, although they might be more likely to say that they felt empowered over their lives, a chi-square test tells them that they're actually more likely to say they feel empowered over their lives by services, by social support services. And so we start to get a picture here that food train or services like the food train are essential in breaking that cycle of physiological and psychosocial risk. And I don't want to go too far into it, but I've done some regression modeling that does in fact support this argument that things like social support do predict well-being and likewise. But what we find is that although we've got indicators of risk to well-being, food insecurity, malnutrition risk, or we've got risk factors for feeling socially supported like older age and living alone, food services can actually completely mediate or wipe out this relationship. And so there's something about having the support that can break the cycle. And my last point here is that although food services did not directly mediate a relationship in all cases, that sometimes they directly wiped out a relationship, but sometimes having such support indirectly wipes out the relationship by making people feel more empowered over their lives. So that's the statistical story that we have to date. We have written a paper about it, so you can read more, but that is the story. And that is the final of the survey before I hand over to Kate to address our final research question, which was, what are the experiences of people receiving food support, and what does this mean to them?
Thanks, Catherine. So we obviously spent a little time with a sample of the larger people that we surveyed, to allow them to have a bit more of an opportunity to talk about what food means in their lives, and to sort of give much more context in terms of how they access, prepare and enjoy food. And we left it reasonably open for the participants to discuss whatever aspect really was important to them. And so a few things that were really interesting to us, the meaning of food in particular. Let me just seem to have lost you. Okay, the meaning of food in the lives of adults could vary according to whether it was still perceived to be enjoyable. This idea of sharing and preparing food for others is something that we start as parents the minute we have the weaning of our child in front of us. You know, it's very much a partnership. It's something that we use. It's very social. And obviously the vast majority, I think we had, what was the percentage that lived alone, the older people that lived alone? We had the majority of our sample lived alone, so they may not have that. And through the realities of aging, such as bereavement and loss, obviously these connections between food and socialization become fragmented. And that was something that was discussed. So here's Agatha saying, it was different when my husband was alive. I liked it if he said, well, I've enjoyed that, you know, if he cooked something, but now it doesn't matter. And likewise, Francis said the spiral of, oh, I can't be bothered eating, it's just for me and there'll be nobody coming round, so you don't need to cook for anyone else. So what we've noticed is that this sort of idea of loss and adjustment to loss can often be expressed through this preparation of food, where there might be choices that are for food and nutritional choices that maybe weren't there before, such as eating colder food or pre-prepared food that's easy and accessible, rather than the hot, maybe nutritious food that was maybe put in front of the person as they collectively cooked for others. The other aspect that we teased out, and you can read more about it in our paper, is the financial barriers to food access were not that prominent. Food insecurity was really not explained that easily just through a lack of financial economic resources. Often there could be food in the cupboard, but it was that motivation to cook it that sometimes was difficult through loss and adjustment, but it could also be through sort of structural and societal changes around the older person. So it could be because there had been a change in the local high street. So John says, now, where I live, we used to have both a butcher and a fish shop, and now they're closed. Lexi says, people have been very good, but it can be a thing. And anxiety, you know, I've got no energy to go across town and get some messages. So the idea of going into large supermarkets that has far more in them than the older person requires, they're often out of town, they may rely on a car. So the way in which our consumption and access to the food system is being expressed through this is not down just simply to a lack of financial resource. So this is an important part of our research. And so we've started to build a kind of picture, which we hope you might find useful in trying to understand and tease out some of the issues that we felt were prominent from our evidence, which give an indication of their health realities which place the older person at risk, such as getting older. But there's much more than that as well. We use the PANC, the Participant and Nutritional Checklist, as a way to start the conversations thinking about unintentional weight loss and rings becoming looser. But we also are bringing into the story the impact of having low mood, a lack of social connection, and the experience of loneliness and loss, which can place an individual at making a decision that tonight they're not going to cook a hot meal, They're not necessarily going to access nutritional food. We've talked about locus of control and this idea of actually the older person may have to reach out to access the services that they need to keep them at home. And the reaching out can be hard for an older person, particularly if they're experiencing low mood. So that's a question for us as well. These services in the third sector may be there, but how does the older person reach out and find them? The opportunities for social eating and social connections is something that's really important too, and the changing nature of the high street. So all of these together start for us to build a picture which we can hope are helpful for others in the field to build on. So just a few seconds, because I know we've run over. The concluding remarks: older adults facing food insecurity and risk of malnutrition are also at increased risk of lower well-being, social connectedness, and the levels of control and empowerment that they feel over their lives. However, food trains seem to really play a role in breaking that cycle that Catherine has talked about. So starting to give that person who may be disabled and have actually quite a lot of health difficulties and psychological differences, but it gives them a sense of empowerment to reach out and ask for help, which is essentially what they had already done by inviting Food Train into their lives. Food Train is supporting very vulnerable older age adults at home. And again, what I said, what little control those food insecure adults have is often attributed to this access to the reliable volunteer-led food delivery service. So Catherine, if you just maybe move on. So the stability of food access to eat and enjoy food provides us with a really critical lens to assess healthy ageing in place. The eating and preparing and sharing of food is inextricably linked to the perceptions of feeling in control, how connected you feel, the physical and mental well-being. And the inequalities we've evidenced are not simply attributable to a lack of financial resources that explain accessing food banks. For instance, it's much lower rates of older adults will access food banks, but it's more about a diminished sense of maybe social and cultural capital, which can affect older adults in nuanced and sometimes hidden ways. Okay, very, very briefly, 10 seconds on this slide. We've seen how quickly previously food secure older people can actually be placed in a very insecure experience through shielding and social distancing. Our research can be used to illustrate the critical role of the third sector in providing these upscaling frontline services. And surely nothing is more essential to life than food. We need to further strengthen and secure dignified access to the food system for vulnerable older adults, many of whom we've found are already exhibiting early signs of malnutrition. Okay. And we obviously did this across a lot of different partnerships with a lot of help, and thanks to all that helped us.
Thank you, Kate and Catherine. A really super overview of the research, and just I think a really great point to be able to demonstrate across the whole third sector, where everybody's working in relation to food and older people, you know, the contribution that is made to the stability of older people's lives, and great to see it in research. I'm just going to move us on. I'm conscious of time, so I'm just going to move us on and introduce Laura Cairns, who's the project manager of our Eat Well, Age Well work. And what we've been trying to do with this project over the last 2 or 3 years is progress and test out a lot of these things that can help move us along in this conversation, so that the overall objective is that, you know, less older people in Scotland and none, if we can get there, experience hunger and the risk of malnutrition and suffer from it. So Laura, over to you. Thank you.
Thank you, Michelle. And can I just get a thumbs up if those slides are viewable? Fabby. Well, thank you so much. I'm delighted to be talking about and raising awareness of our Eat Well, Age Well project. I'm Laura Cairns, the project manager, and I'm going to be talking about our learning and launching our 4 calls to action. So just to take a step back, we're a national project. We're funded by the National Lottery and part of Food Train, as Michelle spoke about earlier. So we benefit from all their 25 years worth of learning and experience in the field. And our core focus is on the prevention, detection and treatment of malnutrition among older adults living at home over the age of 65. Our work programmes include areas such as capacity building, so building the knowledge and skills of individuals and organisations around how to prevent malnutrition, how to identify it and what to do about it. We work on test and change ideas. So we've funded 47 small grants directly in the community with projects working with and having daily contact with older people. And we also funded 10 COVID emergency grants over this recent crisis. We also work on research and data collection. So we've funded the Glasgow uni study to give us a better understanding of the nature of the problem. And we work on policy influencing, and everything we do, we work collaboratively with a range of national and local partners. Just to give a few key facts in terms of what's the problem that we're trying to fix. Well, sadly, and I think Michelle said earlier that the 1 in 10 older people are at risk or suffering from malnutrition. And we can equate this in Scotland to be around 103,000 older people. These are pre-COVID figures. And actually in our own project, we estimate that these figures are higher than this, more like 30%. So that's really unacceptable for something that can be prevented and treated. And it's really a hidden problem, which is often overlooked with the dominance of attention in media around overweight and obesity, and a representation around malnutrition is something that is extreme hunger and only in developing countries. We know that most malnutrition occurs in the community. That's where the risk is. So that's where our project is solely focused. We've got the backdrop of our ageing population. So in future years, there's going to be more older people at risk. But importantly, it has profound impacts on older people's health and well-being. We've got data and evidence that shows that those that are malnourished are twice as likely to visit a GP. They're 3 times more likely to be admitted to hospital, reduced resistance to infections and quality of life. It affects every part and system of the body. And malnutrition in the UK costs, at the last estimate, it was 23.9 billion. So there's the problems. We also have COVID-19 around, and this unfortunately has created a perfect storm for malnutrition. You can see here the range of national organisations also voicing and sounding the alarm about rising rates of social isolation and malnutrition. We've been part of the Malnutrition Awareness and Prevention Network, and we're part of a signed letter that was signed by over 140 different NHS partners and government sort of stakeholders, to raise the awareness of these problems and voice our concern. We received a letter from Scottish Government, which was rather lukewarm and disappointing. So we'll continue to use our voice on these matters. So what are we doing about the problem, and what work are we doing on the ground? So we're working on screening in the community in partnership with a range of voluntary sector, housing, community groups, NHS and social care, in particular promoting and training and supporting staff around the community-based tools. So Catherine was talking earlier about the Patients Association Nutrition Checklist. This has got great potential for early identification. It's a simple paper-based tool that can be easily downloaded. You don't need to use scales or take measurements. And similarly, the paperweight armband that was launched in Salford in 2014 is a simple strip of paper. And these are great non-medical, non-clinical tools that can be used by a wide range of the wider community workforce, so befrienders, carers, and others that have routine contact with older people. And with our partners to date, we've screened 672 older people, and we've found 12% were found to be at risk of malnutrition. So that was work in the community. So we found that 1 in 10 figure. But interestingly, when we move out to other settings, such as domiciliary care, we find those figures have increased. So we found 32%. So it's clearly a need there for more support and guidance. And obviously this setting is working with more frail and vulnerable older people. And moving on, we work on training and education and awareness raising. I've said before, malnutrition is a hidden problem. There's low public and professional awareness. So we're busy voicing our concerns, and we have public information materials that are free to download and are disseminated widely across Scotland. We have our Eating Well for Older People resource that was done in partnership with Age Scotland, and just recently it's been endorsed by the British Dietetic Association. To date, we've trained over 460 volunteers and carers from a range of settings. We deliver the REHIS Eating Well for Older People course and our own RIM training, but we do need to reach more people. So this has led us to our calls to action today. So you've heard from the research from Kate and Catherine and the journey that Food Train have taken throughout this pandemic, and our work across the project, funding our small grants, our screening, our training. This has led us to identify 4 simple calls to action that, if implemented, could make a real and positive difference to older people's lives and save the NHS economy money and social care. Now is the time for change, and we're launching this today as day 1 of UK Malnutrition Awareness Week. So call to action 1 is focused on screening. Screening for malnutrition should be mandatory for all statutory agencies with a role in supporting older people. We know from the evidence we can prevent malnutrition through early identification and screening. And current data is focused on hospital context. There's no routine recording or reporting in community settings. And this reporting and recording in community settings would allow us a true picture of the nature of the problem. There are tools available. We have the MUST tool, which is validated, and we also have these newer community-based tools that have got enormous contribution for the wider community workforce. Call to action 2 is focused on training. So training on malnutrition, unintentional weight loss and health communication about household food insecurity should be embedded in basic training for all health and social care professionals. We've already trained 467 colleagues in health and social care. We know from that work that many were unaware that malnutrition was a significant issue. So that's why we need to reach more people. And if these issues were embedded in basic training, we would make significant increases in prevention, detection and treatment. Call to action 3 is focused on investment. More and better investment should be made in community initiatives that address social isolation by providing befriending and opportunities for older people to eat, shop and cook with others. We know that investment isn't anything new or revolutionary, but the fact needs to be said again. We've found from our research there's a real correlation between social isolation and malnutrition, and the vital community supports like lunch clubs, befriending, that bring people together to socially eat and to socially connect. This is vital, and these are provided by the third sector and need to be enhanced. So real investment could be made through the Older People's Framework to make a real difference. And finally, call to action 4 is focused on food poverty and food insecurity. These are not the same for vulnerable older people. Policy, practice and research needs to take account for this. So food poverty does not wholly explain why older people face food insecurity. It's much more multidimensional. So we heard from Kate and Catherine talking about factors such as choice, decision making, control, and how food access should be paired with social interaction. So these are our calls to action. Please follow our work. Particularly this week as UK Malnutrition Awareness Week. It really is time for change. And at the bottom line, we want to look after the health and well-being of older people. So thank you for listening.
Thanks for that, Laura. A really good overview of the amount of work that the project have got through over the last 3 years and what the potential is for the broader rollout of really simple community screening tools and some really simple pieces of action. None of this is really complicated. We just need that investment and that focus on it. Thanks for that, Tilly, and it's great watching the Mentimeter word cloud just coming to life on the screen, and I think we're all saying exactly the same thing. So thank you so much to everybody for coming along and joining in today. The links have been in the chat about the research report. You can keep in touch on social media and say and see what's happening with Malnutrition Awareness Week through the various links to Food Train Scot and Eat Well, Age Well Scot on Twitter. Myself and Laura and the Eat Well, Age Well team and Kate and Catherine, we'll stay around for another 10 minutes or so if anybody wants to ask anything specific. But huge thank you to Claire Adamson for coming along today and giving us that perspective from government, and to Kate and Catherine from Glasgow University for all their hard work, and to the Eat Well, Age Well team for their great contributions today in helping get this session together. Thanks to all of you for joining in today. Really appreciate you coming along today, and I hope you get something out of this session and that there's something in the research there that's useful for everybody, because it really does highlight what the third sector does in supporting older people to eat well, and that we can keep on working together to improve food security for older Scots and eradicate malnutrition altogether. So thank you very much, everybody.